Good morning and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So today I want to talk about nosebleeds, mainly in dogs, but I'll talk about some other species as well. And basically in nosebleeds, we do worry about several different things. Obviously, you can have a nosebleed if your dog is running around and bumps into something, just like us. The nose is very sensitive and you've got cartilage and really sensitive tissues in there and stuff. So that's definitely a possibility. If that happens, just apply a little cool rag or an ice pack and calm the dog down, let it rest, and watch for any return of that. If it continues, or if it's something that happens frequently, or if it happens when the dog is just resting, those are signs that it's something more serious. And some of the things that can cause nosebleeds like that are fungal infections, Ehrlichia or anaplasmosis. Those are tick-borne diseases. Really important to keep your pets on flea and tick preventive all the time. But these tick-borne diseases actually cause rupturing of the blood cells and cause bleeding problems, and so that's a really common place that we'll see it is in the nose. You can have polyps or little tumors. You can have what we call an oronasal fistula, which is when the teeth are really rotten and the canines fall out or come out and it's not sewn up. You'll actually leave a tunnel from the mouth up into the nose, and stuff will get impacted up there and cause infections and stuff. And so that can cause bleeding if it gets too irritated. You can have tooth root abscesses, sinus infections. There's a whole host of things that can cause nasal bleeding. But the main thing is to have it checked out. The first thing we would do is blood work and what we call 4DX, which checks for those tick-borne diseases. We want to look at the platelets. We want to look at if there's any anemia, and we want to do a slide to look if there's any blood-borne parasites, and check all that out first. If all that is normal, if something comes up, obviously we'd treat that specifically. But if those are normal, then what we would do is X-rays, look for any issues that we can see on X-ray. And then last resort, which is kind of spendy, is rhinoscopy, which is basically endoscopy, but we take like a little, a short, rigid scope and look up in there with the camera and look for any polyps or tumors or anything like that. So those are basically the things. So if you do see blood from your dog's nose, make sure you bring them in so that we can check that out. It is important, and it can get severe, and unfortunately I have seen pets die of Ehrlichia, even, at the clinic, even when we start treatment, if it's caught too late. So we need to catch them early so that we can treat that. In your horses, if you have nasal bleeding, obviously just like any animal, they can get overexerted, and especially if it's really hot and dry outside, and if they're exercising really hard. Not very common, but they can get nosebleeds. Obviously, they can also run into things and cause some trauma, and you can just do an ice pack as well. But the biggest worry with nosebleeds in horses is guttural pouch abscess. So up here, there's what's called a guttural pouch, and you can't see it. Sometimes you can see it with good x-rays, but the best way is with scoping or MRI as well. And so that if that abscesses, then that'll cause nasal bleeding. So if there is a guttural pouch abscess, then it can actually erode away the tissues and then erode the carotid, and you could have the horse bleed out in minutes. So that is something very serious that you need to have checked out. Do some x-rays and stuff like that. In cats, we don't see nasal bleeding quite as often. Usually it's due to an upper respiratory infection. So they get pneumonia and worse up into the nasal cavities and stuff, and that's of concern in cats. And cats are really good at hiding problems, so if you do see any discharge, best to bring them in right away. If you have any questions, let us know. Hope everybody has a great day.